Welcome to this video on Trisomy 21, also known as Down syndrome. This complete exam preparation guide covers key concepts for pediatric nursing exams. Trisomy 21 is a genetic disorder resulting from the presence of all or part of a third copy of chromosome 21. It is the most common chromosomal abnormality and the leading cause of intellectual disability in children. Globally, the incidence is about 1 in 700 to 1 in 1,000 live births. The major risk factor is advanced maternal age, increasing exponentially after age 35. 3 genetic mechanisms cause Down syndrome. Non-disjunction accounts for 95% of cases and is a crucial point for exams. Translocation is the only type that can be inherited. Non-disjunction occurs when one gamete receives 2 copies of chromosome 21 instead of 1. Upon fertilization, this results in 3 copies, leading to a karyotype of 47 chromosomes. The most common genetic mechanism is non-disjunction, and a typical Down syndrome child has 47 chromosomes in total. Key clinical features of the head and face include brachycephaly, microcephaly, low-set ears, a flat nasal bridge, and a protruding tongue due to a small mouth cavity. Eye features include upward slanting eyes, or mongoloid slant, and epicanthal folds. Brush field spots, which are small white speckling spots on the iris, are also characteristic. Hand features include the simian crease, a single transverse palmar crease found in about 45% of cases. Clinodactyly is the incurving of the 5th finger. A notable foot feature is the sandal gap deformity, which is an increased space and often a plantar crease between the great toe and the second toe. Systemic features include profound hypotonia, often described as a floppy infant, and hyperflexibility. Other features are short stature, a short neck, and delayed developmental milestones. Prenatal screening tests assess risk during the 1st or 2nd trimester. Remember the mnemonic high HCG because HCG and inhibin are high, while everything else, including AFP and estriol, is typically low. If screening is positive, confirmatory invasive tests like chorionic villus sampling or amniocentesis are performed. Amniocentesis is considered the gold standard for karyotyping. In the triple test, the finding that suggests Down syndrome is elevated HCG alongside reduced AFP and estriol levels. Congenital heart defects affect 40 to 50% of babies with Down syndrome. The most common is the atrioventricular septal defect, also known as the AV canal defect. Gastrointestinal complications include duodenal atresia, which shows a double bubble sign on an X-ray. Hirschsprung's disease, causing chronic constipation, is also a risk. Hematologic complications include a 10 to 20 times higher risk of leukemia, especially ALL and AML. Neurologically, there is an increased risk of early-onset Alzheimer's disease, typically by age 40. Other issues include common hypothyroidism, requiring routine screening. Atlantoaxial instability risks spinal cord compression, and hearing loss and obesity are also prevalent. The congenital heart defect most specifically associated with Down syndrome is the atrioventricular septal defect. The X-ray finding in duodenal atresia is the double bubble sign. The risk of Alzheimer's disease starts around 40 years of age. Nursing counseling should involve supporting parents through grief and encouraging bonding. Genetic counseling is important, especially if translocation is the cause. To address feeding challenges, place food at the back and side of the mouth. Feed slowly, use long spoons, and clear the nose before feeding due to hypotonia and mouth breathing. Infection prevention is vital, as respiratory infections are a leading cause of death. Interventions include chest physiotherapy, frequent position changes, and complete immunizations. For skin care, use mild soaps and apply lubricants regularly for dry, cracking skin. Due to atlantoaxial instability, avoid activities that stress the neck, like somersaults. When feeding, the nurse should place the food at the back and side of the mouth to counteract the protruding tongue. The simian crease, a single transverse palmar crease, is a characteristic feature of Down syndrome. The risk of giving birth to a Down syndrome baby increases significantly after the maternal age of 35 years. Clinodactyly is defined as an incurved 5th finger. The main cause of death in Down syndrome patients is respiratory infections. In summary, the genetic profile includes 47 chromosomes, with non-disjunction as the cause 95% of the time. Advanced maternal age is the primary risk factor. This chart summarizes key features for quick review, including distinctive facial characteristics and physical findings like the simian crease and hypotonia. Management is symptomatic and supportive. including early interventions such as speech and physical therapy and surgery for anomalies. Life expectancy has significantly improved to approximately 60 years. Thank you for watching this video. Keep learning and growing, and best of luck with your exams.